EFT is not just for couples. EFT has always been used with individuals and with families. So in this week, we're going to look at EFIT, Emotionally Focused Individual Therapy. Over the years, we have used EFIT with many different kinds of problems. We have used EFIT with bipolar folks, with people who've been labeled borderline, with all kinds of traumatized folks with every kind of diagnosis that you can imagine. But in this course, we're mostly focusing on depression and anxiety, which are the two main reasons why people seek out help from a therapist. So how does an attachment-orientated EFT therapist view anxiety and depression? From an EFT point of view, anxiety and depression are best grouped together as emotional disorders. We see both of these, anxiety and depression, in terms of problems of affect regulation and problematic ways of dealing with your own feelings and then connecting with other people on an emotional level. If you listen to people's experience and you look at the basic processes involved, anxiety and depression are not separate. They co-occur. There's an enormous comorbidity rate in our clients. They co-occur so much of the time, and one is a risk factor for the other. Also, we know that when you treat one, you're likely to impact the other. From an attachment and EFT perspective, emotional isolation is a core factor in both anxiety and depression. What attachment science says is that the most traumatic and debilitating experience for us in everyday terms and in terms of the development and growth of our personality is emotional isolation. We are not wired for it. Our nervous system cannot deal with it. It puts us into enormous agitation or freeze mode. It limits our ability to deal with our environment and to deal with our inner sense of vulnerability. And a simple way of thinking about how we deal with this in EFT really reflects Roger's statement when he said, "I enjoy finding the order in experience." We focus on the process involved in anxiety and depression, and we help people find order and pattern in those processes that end up with them saying, "I'm depressed" or "I'm anxious." We focus on the order, we make sense of things in a simple, parsimonious way. This perspective that I'm suggesting here on emotional disorders may be very different from some of the other models of therapy that you've thought about. I want you to notice that it focuses always on core processes, how people construct depression and anxiety, the core processes involved rather than labels, and it focuses on emotional realities and how people engage with others. And it is these processes that EFT focuses on and starts to shape and shift.